Some health problems don't just crash through the door and say, knock, knock, here I am. Most of them slip in quietly, like that coworker who borrows your phone charger and you never see it again. And that's what happened to my dad. That quiet thief was called aortic stenosis, a heart valve problem we didn't even know existed until one random day when he suddenly seemed off more than usual. And I don't mean the usual, well, where did I put my keys kind of off? I mean, what year is it? Where am I kind of off that my mom noticed first? We took him to his primary care where the doctor did the usual slew of tests because I'm thinking maybe dementia. There was something wrong with his heart, among many other things, and it was called aortic stenosis. And at first it sounded like something you'd order a trendy coffee shop, but it turned out to be really something very serious and connected to two other things that are way too common once you hit that midlife, like diabetes and memory problems. What happened in the doctor's office? Well, the doctor heard a murmur. That little swoosh sound turned out to be the first clue that his aortic valve, the main door out of the heart, was narrowing and it wasn't opening and closing like it normally should. It was having a hard time doing that. So aortic stenosis can hide for years, even for decades in my dad's case. And then suddenly, symptoms start coming in clusters. Things like chest pain, dizziness, or some swelling in the leg. Also confusion. And in my dad's case, he mainly complained of shortness of breath and being really tired all the time. My mom honed in on that, his confusion. She knows him best because she's with him 24 hours a day, whether she likes it or not. She is his primary caregiver. Here's the twist. My dad has had diabetes type 2 for decades. And diabetes, it's like a rocket fuel for the aortic stenosis. Who knew, right? High blood sugar damages the blood vessels and the heart valves. They're all interconnected. The body responds with inflammation, and over time, calcium builds up on the valve, making it a little stiffer and more narrower, so it's not as free-flowing as it once was. Gets really interesting because you might ask, well, what's calcium have to do with it? It's interesting. It's a little bit of a wild thing. The calcium that clogs a heart valve isn't from eating too much cheese or any calcium-containing foods or even supplements. It's the same calcium, get this, your blood carries every day to keep your bones strong, your muscles contracting, and your nerves firing. So it has many beneficial roles for your overall body. But over the years, if we don't take care of our body, well, that valve opens and closes billions of times. According to researchers in Frontier in Cardiovascular Medicine, all that mechanical stress, your heart's been pumping since you were in the womb, really. Well, all that continuous pumping causes mechanical stress, and it can wear down the smooth lining of the valve. Once it's damaged from age, high blood pressure, cholesterol, or diabetes, your body tries to repair it, like with any other injuries. And here's the twist. One study found that those repairs sometimes activates the same bone building process used to heal fractures. That's where the calcium comes in. The valve cells actually start acting like bone making cells, layering down tiny crystals of calcium, calcification. In advanced cases, scientists have even found bone-like tissue inside the valve, just like you see in your skeleton. And oh boy, once that starts, it's like getting a lime scale in your coffee maker, the ones that it's really hard to rub off. It just builds and builds until the door of the valve eventually barely opens. And with any chronic diseases, we've got two problems: diabetes hurting small brain blood vessels and other vessels. And then for my dad, aortic stenosis, lowering blood flow to the brain. It's like turning down the water pressure and narrowing the pipe throughout your body, your circulation. And this double hit can speed up vascular dementia, memory loss caused by poor brain circulation. And if you already have tiny silent strokes from diabetes, the valve issue can make things worse really fast. As for my dad, his confusion, it was getting worse. So I wanted him to get checked out and get things ruled out like a stroke. Maybe he had a tiny stroke and that's causing the more confusion. So one of the things with taking care of your aging parents is that if you have family members, not all family members are going to go with the flow or have the same mind thought as what you want to do. And one of the things that I think happens is with some of the other family members, for instance, one of my siblings, a lot of times when issues come up, because lack of knowledge, we'll get into some argument. And in this case, my dad's confusion and one of my sisters saying that the confusion, oh, dad's acting like he normally does. So if I went with that logic, then we wouldn't have gone through and tested him and eventually replacing his aortic valve and him getting better and less confused and less shortness of breath. So that's one of the challenges with caring for a family member, your aging parents, and not having everyone, the family members, in the same page. What did the doctors do in order to come up with this diagnosis? Well, the main test is something called the echocardiogram. It's an ultrasound of the heart, and it measures how your heart functions, how narrow the valve is, and how fast blood moves through it, and how much pressure the heart needs to push the blood throughout your body and through the valve. Well, Dad's valve was in the severe category, and it meant that we would have to do some kind of intervention to fix that. So there are two main interventions for a aortic stenosis, and it's usually done for people who are symptomatic, which my dad was. Also, the severity of the narrowing. You need to replace that valve. And that makes sense, right? If something's not working and it's causing some severe symptoms. So the two main ways is something called surgical aortic valve replacement. And the second one is transcatheter aortic valve replacement called TAVR. And that's less invasive, and it's through the artery in the leg. For my dad, TAVR made more sense. It was safer with his other health conditions, and it wasn't an open heart surgery. So much safer for someone his age. Post-surgery, it went really well. The doctors who do these procedures do them all the time. And we became symptom detectives, watching for changes in his breath, chest pressures, memory, to see if it actually helped. Because when you have diabetes, aortic stenosis, and vascular dementia in the mix, small changes can mean big things. So his recovery included physical therapy and occupational therapy. It's been close to a year since his surgery, and he's doing much better. 1 month to 2 months out of his surgery, he felt much better in a sense that his fatigue, his being tired all the time, did go down, diminish. When he walked, he wasn't as short of breath. He has vascular dementia, and that's not fixable. He is still confused. Sometimes he doesn't remember things or things that he's done or mastered. And I have a separate video about vascular dementia, what my dad is going through. I'll put a link in the description section of this video. If you have diabetes, it's really important to check your heart, because diabetes, if you have it, you have a 50% more likely that you will develop aortic stenosis. Don't ignore new symptoms, especially if they involve your breathing, your chest, or your memory. And sometimes the heart and brain are telling the same story. They're both running low on supply. Fix the valve and you just might give the whole system a fighting chance. Thank you everyone for watching. See you next time. Bye-bye.